Hundreds of GPs are dropping out of the vaccination program as they're not getting enough doses. Charlotte Hespe, Sydney GP and Director of the Royal Australian College of General Practitioners, joins us for more on this. Charlotte, 200 GPs have dropped out of the vaccination program since February. Are you surprised?
Probably I should say no. I mean, I'd like to say I was surprised, but no, unfortunately I'm not. It's been a very frustrating process. The whole sort of way in which the numbers have allocated and the way in which the department responds to that has been, not particularly easy to navigate and negotiate.
What are you still experiencing? Are you still turning away patients?
Absolutely. I've said before, my practice has been allocated 50 doses. With the new allocations, that means we now do get 150. But even with 150, we've got a lot of demand and people waiting to be able to access the system. We've got a system set up so that it means that only the number of patients can be allocated to a slot when we've actually got the vaccine in the door, and that's actually to make sure we don't have a problem of scheduling and then having to unschedule. But it's very, very frustrating, can I say, and very slow.
How did you feel yesterday when the Prime Minister was speaking about the milestone we made yesterday with administering a record number of jabs?
Look, I'm extraordinarily proud of us because we have, in the general practice setting, been amazing in the number of doses that we have actually administered. But then I'm extraordinarily frustrated because if we've managed to do that despite all of this problem with numbers, imagine how many vaccines we could have actually administered if they'd actually been responsive to where the vaccines are needed and the GP saying where they need more doses rather than, I know of several practices which have got, say, 3,000 to 4,000 doses sitting in their fridge unused, with practices just down the road tearing their hair out because they haven't got any.
What do you think is the biggest problem? Is it communication, the way it's been run? How can this be improved?
Look, it's around the way in which the doses have been allocated. I'll be very open and honest here. I have got no idea what formula was used, and I think I would be as brash to say that no formula was used. Somebody just randomly allocated where the numbers should or would go without actually understanding that most people really, really want to go to their own general practice to have the doses given. So we need to prioritise the general practices with the numbers of patients, and they can tell you. So I can ask my practice and say, how many do you think you can do each week? And they will tell you, rather than being told by somebody who's got nothing to do with the practice, allocating this random number, which by and large for most of the practices is far too small, and then for this small number is much too large. And those numbers could actually be utilised straight away in other places.
Getting more supply to GPs, I suppose this would really help with vaccine hesitancy, wouldn't it? I suppose people could go speak to their GPs, voice whatever concerns they have about getting the vaccine, as opposed to going to a clinic where they aren't aware of any prior health problems.
Yeah, absolutely. And I hear this all the time. Really, I don't think I have a consultation without a conversation about COVID and about vaccination and what that means. And I will talk to everybody about what their options are, where they can go and access it. And a very large percentage of my patients just want to wait until we can roll it out for them because they trust us, they know us, and it's close to home. So if there's any issues, then they feel like that's the place to be.
Charlotte, I have to ask you, what do you make of the Queensland Premier Anastasia Palaszczuk and the Chief Health Officer in Queensland not getting the coronavirus jab yet?
Leadership is about leading where you want to go. So I'll leave it at that.
It struck me, and I know I'm not the only one, but I suppose concerning that the Chief Health Officer in Queensland doesn't want to get the AstraZeneca jab even though she's in that category. You can understand how that would potentially fuel fear in people who are in that category as well and don't want to get the vaccine.
My voice on this would be, say, look to New South Wales, where we have really, I think, led a very good response. We've got really high numbers of vaccinations happening. Our Chief Health Officer, Kerry Chant, very early on had her AstraZeneca vaccine. Our Premier has had her vaccination. I've had mine. Danielle McMullen, who's the president of the AMA for New South Wales, has had her vaccination too. We are leading by example because we absolutely know that the risks that people are talking about are extraordinarily small, but the benefits for both me as an individual and to all of you as a community are huge.
Dr. Charlotte Hespe, thank you so much for taking the time to speak with us today.
Thank you. Have a good day.